We will be discussing homelessness among Indigenous peoples of Canada with a focus on women. Aboriginal homelessness in Canada is a crisis that should be considered an epidemic. While Indigenous people comprise approximately 5% of the overall Canadian population, they make up over 30% of the Canadian shelter population. Furthermore, Indigenous women are overrepresented among females experiencing homelessness in Canada. Over a one-year period, there were over 10,500 admissions to Indigenous shelters for victims of abuse in Canada, with the vast majority being women and their accompanying children. About 70% of women and children in Indigenous shelters in Canada and 20% of women and children in non-Indigenous shelters are Indigenous, while they only represent 4% and 8% respectively of all Canadian women and children. A 2017 survey conducted by the Native Women's Association of Canada showed that 18% of participants reported living in unstable, unhousing, for example, shelters or staying with friends.
Indigenous women face challenges that might partially explain their overrepresentation in the homeless population. The Indian Act, established in 1876, is unfortunately still in place today. Sections 28 and 29 of the Act state that lending institutions cannot seize on reserve assets in the event of a faulty payment. This makes lending institutions reluctant to lend to Indigenous people, making it challenging to accumulate enough funds to purchase a house on reserve, leading to a lack of affordable long-term housing. In addition, we cannot ignore the role of intergenerational trauma as a risk factor for homelessness. Indeed, residential school, which hosted the Indigenous genocide and the ongoing remnants of colonialism, have stripped Indigenous people from their traditional livelihoods. It has weakened their ties to their culture and forced them into vulnerable positions in society. Trauma being highly correlated with substance abuse and intimate partner violence, we report those risk factors at higher rates in the Indigenous population than in the non-Indigenous population. And in fact, around 25% of homeless people attribute struggling with substance abuse as the primary reason for homelessness.
Our logic model illustrates causes of poverty and homelessness among Indigenous women in Canada, as well as opportunities for intervention. Some causes of poverty include limited employment opportunities, gender-based discrimination, and intergenerational trauma. The interventions we explored to prevent poverty include the Indigenous Skills and Employment Training Program, amendments to the Indian Act, and self-determination of Indigenous governments. Some of the causal factors that push Indigenous women into homelessness include intimate partner violence and a lack of adequate, affordable long-term housing. The most effective interventions for alleviating homelessness include the Housing First approach and Indigenous shelters for women. Adverse childhood events are also included in the logic model, as Indigenous children whose mothers live in poverty or experience homeless will be exposed to the same unhealthy environments. Finally, some of the outcomes we can assess to determine if the interventions are effective include life expectancy, quality of life, morbidity, mental health, and number or severity of traumatic life events.
To gather our data, we primarily searched Google Scholar, PubMed, Scopus, and government websites such as Statistics Canada using keywords. We focused a large part of our information collection on initiatives that were Indigenous and/or female-led and involved Indigenous persons' input. Results? Protecting women's rights and promoting gender equity is inherently linked to preventing homelessness by providing secure work opportunities, ensuring safe living environments, preventing domestic violence, as well as supporting women with children. Colonial systems dehumanize and oppress Indigenous women, condemning them to poverty, sexual violence, and murder, which support the conditions for homelessness. For years, the Indian Act discriminated significantly against Indigenous women. For instance, until modifications to the Act in 1985, when an Indigenous woman married a non-Indigenous person, she lost her Indian status, including her treaty and property rights. Harmful clauses that denied the grandchildren of these women their Indian rights, also known as the second generation cutoff rule, still remained until August of 2019. However, the ramifications of this gender discrimination have long-lasting implications, and there is still an additional unmet need in protecting gender diverse Indigenous peoples. Uprooting these colonial systems and laws, which legally define Indigenous people, to allow Indigenous self-identification and governance would be an important step moving forward to protect Indigenous women. In addition, the federal government has been highly criticized for their lack of action focused on missing and murdered Indigenous women and girls. Concrete steps forward in addressing this pertinent issue are required to safeguard Indigenous women from violence and oppression.
The Native Women's Association of Canada recommended providing meaningful economic opportunities for Indigenous women in their communities. Employment and Social Development Canada and Indigenous partner organizations have collaborated on several programs to meet this need, including the Aboriginal Skills and Employment Training Strategy and Skills and Partnership Fund. After 1 year, participants showed a 5% increase in the incidence of employment and a 17% increase in average annual employment earnings. The Indigenous Skills and Employment Training Program is a result of the ESDC engaging with Indigenous partners to review and renew assets. ISET builds on the successes of assets and the lessons gleaned from Indigenous partners to now include a co-developed program with Indigenous partners, increased funding, greater flexibility for service delivery organizations to design programming, and a new distinctions-based strategy that recognizes, respects, and reflects Canada's Indigenous peoples, specifically the First Nations, Métis, and Inuit, but also addresses the urban and non-affiliated service delivery needs.
Housing First, an organization, but also an approach that has shown to be more effective in getting people experiencing homelessness off the streets. Housing First is the idea of housing an individual before offering any other service. Giving the individual choice allows them to be an active participant in their housing and their path to recovery. They decide on the location and type of housing they require, and that which is provided is most successful when permanent and affordable. Permanent housing avoids possible eviction, for example, and thus makes it easier for them to stay out of homelessness. Affordable means that the individual must be able to pay for rent, taxes, and any other cost that isn't above their abilities and that would otherwise result in them losing their home. Once housing has been established, social services are then offered, but again, based on the individual's requirements and them wanting the service. For Indigenous women, services that are important to offer are ones that focus on cultural support groups, adhere to their cultural healing practices, and a large focus on trauma care services.
Indigenous women are disproportionately affected by all forms of intimate partner violence, with 6 in 10 Indigenous women experiencing IPV in their lifetime, such as physical violence and feelings of being controlled. This contributes to the intergenerational trauma and furthers violence earlier mentioned. Women's shelters are classified as a more common short-term one or second-stage programs. Second-stage shelters are longer-term housing so that women and children will have the time to get sustainable support. However, despite its effectiveness and demand, there's a lack of shelters tailored towards Indigenous women, and there are issues with a lack of funding and staffing. To illustrate, Inuit women experience a disproportionate amount of IPV, but if they live in Nunavut, they won't be equitably served since the territory does not have any second-stage shelters at all. This inequity can be addressed by increasing the number of shelters as second-stage shelters throughout all provinces and territories in Canada.
Potential challenges include gaps in support, such as theft of Indigenous lands, childcare, post-secondary education, essential skills training, and remoteness, and administrative challenges such as short program duration, funding deficits, limited capacity of service delivery organizations, heavy reporting burden, partnership preservation, and incomplete data collection.
Most of the available evidence on the topic originates from online and in-person surveys with a relatively small sample size. And because those surveys are subjected to a range of biases, such as interviewer bias or recall bias, the quality of our data can probably be rated as moderate. Unfortunately, there were no systematic reviews available on the subject. And we also know that homelessness is inherently hard to quantify and often underreported.
Many of the services and interventions need to be delivered in a culturally safe manner. Examples include hiring more Indigenous staff, having navigators, having translators, and having cultural safety training modules for existing staff. Furthermore, this is a multidimensional issue and there is no magic solution. Therefore, there needs to be more research done within the Indigenous context, with Indigenous co-authors and ensuring sustainability of results.
The current COVID-19 pandemic further complicates this issue and has rendered Indigenous women more vulnerable. Social isolation and higher levels of anxiety have resulted in increased documented cases of intimate partner violence, of which Indigenous women are already particularly vulnerable to. Lack of proper sick leave policies and support for small businesses means women, and particularly those with children, have become more vulnerable to the economic disparities of the pandemic. And compounding the already limited number of shelters that cater to Indigenous women, public health policies and low staff numbers have caused shelters to limit the number of available beds that they can offer. Curfew laws also unfairly target those experiencing homelessness, causing them to seek shelter or hiding in unsafe places or to be subject to police retribution.
The metrics we have selected to measure the success of our interventions include gender equality indicators, employment indicators, incidence of Indigenous women using shelters, housing first placement indicators, and self-sufficiency indicators. Significant associations between the aforementioned interventions and improvements of these metrics would encourage policymakers to devote funds and other resources into the continuation, evaluation, and expansion of programs geared toward better serving Indigenous women facing homelessness in Canada.
Poverty and homelessness among Indigenous women are multifactorial. Thus, it is imperative that Indigenous Services Canada, the department that delivers federal government services to Indigenous people, works in partnership with Indigenous governments and other government sectors to implement the suggested interventions. It is important that Indigenous women be regularly consulted for recommendations and feedback in order to empower them, support self-determination, and give them control over programs that are meant to support them. Ensuring that services are culturally appropriate will also be key to their sustainability and effectiveness in preventing or helping Indigenous women experiencing poverty or homelessness. Thank you.